All right, so I'm doing a case study for obsessive compulsive disorder. OCD is characterized by thoughts or feelings that center around a particular subject or action. So they're obsessions and physical actions or vocalizations that reflect those obsessions, which are called compulsions. So an obsession that leads to compulsive behavior and that interferes with daily life is a sign of obsessive compulsive disorder, and it can appear in 2 to 4% of all Americans at some point in their lifetimes. So it's pretty prevalent. Um, the patient in my case study was admitted to the psychiatric ward of the hospital because he had been experiencing deep, uncontrollable urges to smash his own hand repeatedly against hard objects. And of course, that's not a obsession or that's not a compulsive behavior that's common to all people with OCD. There are many different types of compulsions that people can deal with. Sometimes it's, swishing spit in their mouths or organizing things, as the stereotype tends to go. So there are so many different types of compulsions that you can't even categorize them all. But this is what this particular guy is having trouble with. And although not previously diagnosed with a disorder, probably because he was just waiting around, and a lot of people deal with OCD and don't tell anyone about it. So he's waited until his has gotten very bad with not knowing how to deal with it or manage it. So he admitted to having similar urges before, although not ones that were so strong that they resulted in causing physical harm to himself. Since his hand was fractured from the repeated behavior, this was treated as well, but the hospital psychiatrists attended to his more obvious need, which was to find some relief from his OCD before he caused even greater harm to himself. The patient noted that he was fully aware of the futility of his behavior, which is typical for OCD usually, and was in significant distress over the harm he was causing himself, and expressed an intense desire to stop, but an inability to control his mind's own prompting. So an SSRI called fluvoxamine or Luvox was prescribed for the patient. And so SSRIs are commonly used for different types of mental disorders. And he was referred to cognitive behavioral therapy or treatment from a licensed private therapist after hospital discharge when he responded favorably to the drug. So, usually, a combination of drug therapy and cognitive behavioral therapy is most effective for treating mental disorders. So, other medications that he could possibly use in the future if the Luvox stops working as well as it used to could include other SSRIs such as fluoxetine, paroxetine, and sertraline. And I got this information from a textbook called Abnormal Psychology by Susan Nolan Hoexima. He would attend therapy twice daily until the symptoms subsided to manageable levels that enabled him to prevent further hospitalizing injuries to himself, and then decrease his visits until therapy was only needed once or twice a month, depending on his responsiveness to the therapy. So if he continues to have a lot of trouble, then of course he's going to have more frequent therapy sessions, possibly even for the rest of his life. But if he does respond pretty favorably to them and he's able to incorporate the techniques he learns at home, and he's able to function pretty well and go back to work or do whatever it is that he does on a daily basis, then those visits can be gradually decreased until they're not as common. So that's my case study.